Okay, let's talk about ATC versus PRN dosing because I've encountered a lot of confusion with this lately and I want to clear it up. So, as you see, we have two separate orders here because these are two separate orders even though they look very similar. I've created a sort of fake MAR for Mr. John Doe with no known drug allergies up here. Starting on December 18th, 23, we have midazolam 5 mg sub-Q Q8H ATC, or every 8 hours around the clock, at 4, 12, and 8. And we also have 5 mg midazolam sub-Q Q2H PRN for agitation or shortness of breath, which doesn't have a time because it's not scheduled, because these are separate orders even though it's the same medication and the same dose amount and the same route. So we got the order, we started at around 12, we built the schedule around that with the every 8 hours, gave the first dose then. Clearly, Mr. John Doe was still having some symptoms, so we gave him another dose around 1 o'clock because the schedules are entirely different. What I've been encountering is some confusion over, we can't give it because we just gave a dose, but that's the first order, not the second one. Because these are separate orders, they have their own schedules. Because we gave one at 1 o'clock for the PRN, we would wait until 3 if he needed to have more around 3 o'clock. Anytime after that, we could. It's a completely separate medication and separate schedule. Where I've been encountering this fairly frequently recently is with a patient with dementia who has some episodes of delirium that needs an extra dose of Haldol, and staff in a retirement home reported, we just gave a dose, can't give it again. We can, because the PRN is a separate dose, we don't need to wait until the next, even halfway between, the schedules do not relate to one another. We're going to use that PRN dose to treat the symptoms in between. So whenever those symptoms occur, that's when the medication can be given. It doesn't matter if it was just given. In some situations, we may even give both at the same time if the patient's experiencing significant symptoms, such as a pain crisis, and we're looking at pain medication. So we're not going to look at the schedule. We're not going to try and split up in between or anything like that. We're going to use the patient's symptoms to guide us on when we're going to give that as needed medication, because that's when they need it. So hope this clears it up. If you have any questions or comments, drop them below. And if there's anything you think I should cover, especially with palliative care, please let me know and I'd be happy to do that.